So, I guess that's my last question I want to ask. If you had like one thing that you could recommend, like one fix for Anguilla to decrease the incidence of diabetes, what would that be? If you had a magic wand and you could, use your wand to make this thing happen, what would you say?
One.
Yeah, just one. I mean, you can do. I thought one was hard enough, but if you have more suggestions.
Okay, so I guess the main one would be come to your doctor. Find a primary care physician, so a regular doctor. So it's not going to the emergency room.
You hear that, mother?
It's not going to the emergency room to see. Yes, if you have an emergency, go to the emergency room, by all means. So accident and emergency. If you've had an accident or it is an emergency, the clinic is closed, go to the emergency room. That is the indication. But you need to have a regular doctor who is going to go through the regular things with you. So we're going to do your preventative screening. So for the men, we're going to be doing your PSA. We're going to be looking at your lipid profile, colonoscopy if you're of age. For the lady, your mammograms, your pap smears, and yes, colonoscopies as well. So we're going to be doing the general maintenance checks that are important for your age group, depending on what age. You're not going to get that at the emergency room. So I want to encourage the practice of screening. Don't wait until you develop symptoms. Don't wait until you feel bad. Come early. We're nice doctors. We don't bite. Yeah. I want you to come. That's the
that is a mindset that really needs to shift on Anguilla. We do tend, well, not we, because I do see a doctor regularly, but we tend to only go to the doctor when we feel ill, as opposed to waiting, as opposed to doing it routinely beforehand. And that's problematic, because when you feel ill, that may be when we find out that you have metastatic colon cancer. And at that point, there's not a whole lot that we can do. But if you've gotten that colonoscopy at 50 or 45, now is the age for people of color, there's a chance that that polyp would have been found and removed, and that metastatic colon cancer would never have happened. So I would echo the same sentiments. Preventative care is super important. You've got to, in the spirit of Diabetes Awareness Month, one of the things I want to recommend people get actually is a hemoglobin A1C. It tells us what our blood sugars have been doing over the last 3 months. And it's important to know what your blood sugar is doing. If you're in the pre-diabetic range, great that we found it at that point. We can take the necessary steps at that point to reverse it to normal range. But if your hemoglobin A1C is 13 when you come in, we've got a bigger problem, right? So preventative care is key. Is there anything you want to leave the audience with as a last message?
So you've made the first step. Education is key. So coming out to these events, taking the initiative to have events like this is really important. Mm-hmm. Don't let the education stick with you. Share the knowledge. You have family members, you have work colleagues, particularly the men. This goes out to the men. We as ladies,
My brother-in-law just rolled his eyes so hard. Oh my God, go ahead.
Your sister smells trouble. But yes, to the men. Us ladies, I feel as though we may be more familiar with health care. I may be wrong, but for those who have children are accustomed maybe taking their children to the clinic for immunizations, females tend to be more familiar with health, given that we have periods, we change, and therefore we accept change a little bit better. Mm-hmm. Men get afraid. Men don't get afraid, please. Some men say, man, well, I ain't going because I don't want to know. If I don't know, nothing ain't gonna happen. Like, as soon as I find out, there's a problem.
He's smiling. He agrees.
So I want to encourage you that prevention is better than cure. Understanding what is happening is better than finding out late. Ignoring a symptom is a problem. Coming in early and checking is advisable. The same person I am here on the stage is the person I am in
your
clinic.
office.
Yes. I do not change. So I would encourage you to come. I have your screening. Ask the questions that you want to ask. If you're afraid of the medication and what the medication will do, talk to your doctor about it. Because a lot of the times it is that fear that prevents us from stepping out and getting the preventative care that we need.
Right. Does anybody have any questions for Dr. Perkins before she leaves? Yeah. Is there a mic? I think there's a mic back there. Can you use the mic for us so everybody can hear?
Can you hear me?
Yes.
Do you see a lot of people in Anguilla try
Come
to
closer
take,
to the mic.
Do you see a lot of people in Anguilla come and try to take a holistic approach to diabetes?
I snigger because
Yeah, they're going to take, what did they say? Moringa? And they drink
Bush.
moringa bush for the
medicine.
diabetes.
So, do I see a lot of people taking a holistic approach to managing diabetes? That was the question. Yes, so bitter tamarind, moringa. I tell persons there is a place for bush, and then there isn't a place for bush, okay? So if you are coming to me, your hemoglobin A1C, your HbA1c is 10, we don't have any time for bush right now, okay? We got to get this controlled, okay? If you are in your pre-diabetic stage, you are now employing lifestyle modification. Your lifestyle modification means that you're not going to go and drink your coffee with creamer that has added sugar. Well, now is the time to have your cup of bay leaf tea or cup of lemongrass tea. Use your alternatives at that point in time. Your green pawpaw in your stews, in your soups. That is the time for it. But when you are uncontrolled and you have been diagnosed and now we need to manage you, marrying the alternative forms of medication, of treatment, so your bush medicine and traditional medicine is not advisable, right? I have seen people develop hepatitis, so inflammation of the liver, because they have done that. Bush medicines have value to them, as you know. Our forefathers used them. That's because they have chemicals to them, they have compounds to them that, yes, do work, but the problem is we don't know how much. If the tree didn't have water, it's going to have maybe a higher concentration. If it had too much water, lower concentration. But if I give you one paracetamol, I know how much is in 500 milligrams of paracetamol,
Exactly.
right? So, and if you know you have a condition and you want to manage a condition, and I know that the 500 milligrams of metformin is going to control that condition, I would think that you would want to know and use what is going to control your condition. But it's always important to talk to your physician, work through why we think the way that we do, and then talk to us about what you are afraid about, and then we can then help you figure it out.
Right. And one more question, because I know after tonight, everybody's going to go looking for a primary care doctor. Do you have any openings?
Oh. Well, we always do. So how it works at the Valley Polyclinic, which is Central Polyclinic right there, Monday to Friday mornings, we offer a walk-in service. So from 8 o'clock in the morning, you can come and place your name down, and then you'll be triaged by the nurse according to your needs. Then in the afternoons, I'm based there totally now. So in the afternoons, we have appointments. So you can call 497-2702. And you can book an appointment. I have appointments in the afternoons running from about 2 until about 4:30. And that's where we do our routine services. You have Western Polyclinic. There are two physicians there as well. You had Dr. Deslin Hughes here last time. So yes, you can book there as well. They offer appointments both morning and afternoon. Because we're more centrally, we offer a walk-in service to kind of accommodate the acute things more often and take pressure off of the hospital. But you have lots of choices here. We have good physicians here, and you have.
Is that Dr. Clapping? Okay. We have great physicians here.
Thank you. Who really care, like, I genuinely care about my patients. And I think here you're privileged in that way that you have someone with experience dealing with your case. So we don't have junior doctors here in Anguilla. We don't have a training hospital. So the doctor that you see has been a doctor for quite a while. And as such, will bring that expertise to the table. And we can't be experts in everything. I'm not a vascular surgeon, so I cannot speak to anything about vascular surgery in detail. But where I recognize that I don't have the competence or the confidence in dealing with that particular case, I refer. So in Anguilla, you have the options. You have your physicians. You have Central. We have Welch's Polyclinic as well, and we have Western Polyclinic. So I would encourage you, book, come and see us, and we are happy to help you all the time.
Awesome. Thank you so much.